every Sunday on NBC.
In today's Daily Health, September is Gynecologic Cancer Awareness Month. These are cancers involving the female reproductive system, including the cervix and ovaries. And according to the National Cancer Institute, this year alone, more than 108,000 U.S. women are expected to be diagnosed with one of these cancers. Joining me now is Dr. Lucky Sekhon. She is a board-certified reproductive endocrinologist and infertility specialist, and also she's an OBGYN. Super qualified. Thank you very much for being here to talk us through these really important topics in these cancers. Which are the cancers that you want women to be aware of?
So there are many different types of GYN cancers. The most common is uterine cancer in this country. And this tends to affect older women in menopause, and the #1 risk factor is obesity. And then you have ovarian cancer, that's second most common, and unfortunately, it's the most deadly. It tends to be diagnosed in later stages because there aren't so many obvious signs or symptoms. And then you have cervical cancer, which is one of the most preventable forms of cancer thanks to the HPV vaccine and pap smears. And then less common but still important are vaginal and vulvar cancers, which tend to affect older women.
So these are different cancers that are distinctive. We know early detection is always so important. What are some habits and screening tests that you want women to know about that they should be incorporating in their 30s, 40s, 50s?
Yes, so I think, you know, if you see or feel something, say something. Talk to your doctor. Don't wait for your annual exam. If you're having irregularity in your cycle, you're having bleeding between periods, bleeding after sex, that can be a sign of things like cervical cancer. If you're feeling bloated or you have a decrease in appetite because you're feeling early fullness, those are some telltale signs of ovarian cancer, and they're very nonspecific symptoms. And then if you're having any sort of skin changes, rashes or burning or discoloration or any lumps or bumps that weren't there before, talk to your doctor. It's really important to consider getting the HPV vaccine. It's very effective at not only preventing cervical, but also vulvar and vaginal cancers. And this is something that anyone can get from age 9 to 46.
Oh, wow.
Avoiding smoking is always a good rule of thumb, and then maintaining a healthy weight and healthy diet.
Talk to us about family history for folks who actually are fortunate enough to know their family history. What can you tell your doctor, and at what ages do you recommend people dig into that and make sure they are getting their annual checkups and screenings?
Yes, such a good point. So if you have a known family history where there are multiple family members affected by the same cancers, or there are family members that were affected by cancer at a very young age, that's a sign that you should talk to your doctor about whether it makes sense to do targeted genetic testing to see if you have any gene mutations that predispose you to a cancer diagnosis.
Is that a blood test?
Yes, it's a blood test, and there are different panels of tests that can be done, and this might change how often you're screened, how early your screening starts, and there's also different reproductive options you can consider to avoid passing the gene mutation to future generations.
That's really important. I think that's new, and people aren't as familiar with these genetic blood tests that you can ask for. Some of them are kind of at-home kits as well.
Right.
And before we let you go, Dr. Sekhon, let's talk about this idea that, you know, we women, we keep these things to ourselves. We're not comfortable talking about it. I know you want to remove that stigma.
Definitely. I think all too often people are normalizing their pain and their symptoms, and they're thinking it's all in their head. And a lot of times they're told by society and even the medical establishment that it's in their head. And I think, thankfully, we as doctors are recognizing this and really encouraging patients to advocate for themselves.
Well said. Dr. Lucky Sekhon, we were very fortunate to have you with us today. Thank you so much for your time.
Thank you.
Much more news ahead. Stay with us. You're watching NBC News Daily.